My hospital, Beth Israel Deaconess in Boston, excellent hospital. However, I have a dispute with the guy who runs their health IT. He published in June why, it's a good post about Apple Health Kit, but he slanders activated patients. Now, I'm going to take issue with this publicly for the first time here. First of all, he was talking about view, download, and transmit, this meaningful use requirement. He says, viewing is great. We've had that since 1999 for all patients and all data. False. Sorry. There's lots of my data that I have not been able to get at, even today. All right? Second, download makes little sense, since at the moment there is nothing a patient can do with a download. This is what in software we call a chicken and egg error, right? No wonder innovators can't do stuff to absorb this data because we can't get at it. It's like saying, look, nobody's ever tried to access a web page. Who needs browsers, right? Which is pretty much the way people thought in 1994. And then, of the 2 million patients at Beth Israel Deaconess, not one has ever requested a download. Well, excuse me. I have requested a download, and here is the documentation. When I went into my patient portal and asked tech support, I said, so to be clear, to download my complete history, there is no download my records command. And they replied, that's correct. So I don't know what he's talking about, but I take it as an insult, because a lot of people read this blog and then go out and say, well, we should drop that requirement because patients don't want to get at their information. Well, you know, culturally, after 500 speeches in 15 countries, I've heard a lot of stuff but that boils down to, well, look, okay, Dave, you're an activated patient, but my patients aren't like that. Nobody's asking for this. Well, here's where we get into feminism. Because 104 years ago, in 1912, when the 19th Amendment was on the ballot, the National Association Opposed to Women's Suffrage said, vote no, and the top bullet there says 90% of women aren't asking for it. You see the parallel? It is a mistake to say nobody's asking for it yet, so there's no market for it, okay? Here's my Twitter avatar photo. I want a medical record spigot. I want to be able to just open a faucet and let all my data flow out.